In your health tonight, maybe you're one of the 200,000 Coloradans who will see health care premiums more than double next year, or maybe you know someone who is. But right now, open enrollment is in full swing, and plenty of Coloradans are having to make some tough choices. Denver 7's Adria Irahita shows us the way Connect for Health Colorado is helping folks navigate the process.
Long COVID turned Chelsea Baker Hawk's life upside down. 5 years later, she says this is her new normal.
I get an all-day infusion for 2 days every 2 weeks it's this IV immunoglobulin, which is like the immune systems of thousands of donors basically pooled into an IV bag for me.
The treatment's price tag, $174,000 a month.
So you could see where there's no way anybody but an ultra wealthy person could afford this kind of medical care without insurance.
Chelsea's health insurance premiums are about to double, jumping 101%. She's one of 225,000 Coloradans facing the same sticker shock. Federal enhanced premium tax credits that have been reducing costs since 2021 are expiring, leaving people like Chelsea who count on this coverage with some tough choices ahead.
Really, the only way I can make up the difference in what I have to pay in the premiums for the coming year is to cut out some of the medications that I pay out of pocket for and groceries.
Now, Connect for Health Colorado is teaming up with groups like Servicios de la Raza, hosting enrollment events to help Coloradans weigh their options.
They are very worried about being able to get health insurance. Either they have roof under their head or food on their table or get health insurance.
Colorado's Premium Assistance Program will help some people lower their monthly costs, but not everyone is eligible. As a result, the Colorado Division of Insurance estimates around 75,000 Coloradans will end up without coverage next year.
It's a sad situation for us seeing those faces of the people not being eligible to get that assistance.
These aren't just financial decisions for people like Chelsea. They're about survival.
It's more stressful than the disease I have.
In Denver, Adria Irahita, Denver 7.
A lot of tough choices. Also in your health tonight, a CDC advisory committee has made a significant change to vaccine recommendations for children, rolling back the recommendation that newborns receive the hepatitis B vaccine at birth. So what does it mean for Colorado kids? Denver 7's Veronica Acosta spoke with a Denver public health expert alarmed by this decision.
After heated debate, the Center for Disease Control and Prevention's Vaccine Advisory Panel has decided to roll back a decades-long recommendation that all newborns get a first dose of that hepatitis B vaccine within 24 hours of being born. This decision was made Friday. Here in Colorado, the state's Department of Public Health and Environment issued a release Friday after the decision was made, saying it still recommends healthcare providers continue offering that hepatitis B vaccine to all newborns when they're born. I spoke with someone over at Denver Health who explains why they believe this vaccine is so crucial.
The impact is going to be that there will be probably more people that will elect not to get the vaccine. And so those babies are vulnerable to getting the infection.
Hepatitis B is a liver disease caused by the hepatitis virus. In studio, Veronica Acosta, Denver 7.